Hey everyone, it's Dr. Karen, the women's midlife specialist. And this is a very interesting set of labs. And they belong to a gal we're going to name DL. She's 48 years old and she is premenopausal. She does not define her cycles as irregular. So I would say premenopause is accurate. So she's using a BiEst with progesterone, which she says is compounded. I don't know how much or what percentage of BiEst it is. If it's hormone heaven, then it's an 80-20. Now, there are others that you can get compounded like 50-50, but if it's hormone heaven, it's going to be an 80-20. And hopefully, it's not anything but 80-20 because if you're premenopausal, you should not need any additional estradiol than an 80-20, a 20% estradiol, 80% estriol. Many doctors, even some functional medicine physicians, more on the conservative side, would not really even use an 80-20, would not use any estradiol at all until they're done with menopause. Not many, but there are still some out there. But in any event, here's what we've got with DL. So DL is also on pregnenolone. And remember, pregnenolone is at the top of the chain. So I generally only use this in the geriatric elderly population because there are too many unforeseen possibilities with using hormones that are so high up on the hormone cascade. You really just don't know what is going to happen with them. Okay, so she's using a 25 milligram dose of oral pregnenolone. When I start a geriatric patient on pregnenolone, I always start with 10 milligrams. However, commonly we get up to 50, and many times we can even get up to 100. And this is in the geriatric population and females I'm talking about. Interestingly, one thing that I have not shared before that I can recall on one of these videos is that women generally need more pregnenolone than men. And I find that very interesting. But in any event, right now, DL is on 25 with a twice daily topical biestrogen, with that has also progesterone in it. Let's take a look at her labs. So her estradiol is 7, and for replacement therapy, normal is between zero point 0.8 and 12. ZRT is very conservative with optimal levels of 1.3 to 3.3. However, I do find women are far more comfortable if they are at uh, higher ranges of estradiol here. Usually 3.3 is the higher end of optimal range, and they definitely feel better at that. 4, 5, 7 might be a little higher than we need to go. Progesterone is fine, and then the progesterone to estrogen ratio of 207 with this BiEst is with progesterone is excellent. Estriol is 284, a little bit higher than recommended, and estrone is what really bothers me. 13.7. This is elevated, and this is not supplemented at all. She's using a BiEst. We don't use a Triest anymore. So this is either coming from fat cells or coming from the conversion of her hormones. And when we look at her BMI, she's a tiny little girl. So it's not coming from fat cells. This is coming from either her BiEst with this estradiol, which isn't really high. So not sure, but it could be, or it's coming from this pregnenolone. All right. Okay. Now testosterone is now at a good level of 32. So for the use of a BiEst with progesterone, these values here are absolutely fine, but I really don't like this high estrone at all. So let's see what else we've got. These are some of the charts. Okay, so here's what I want to show you, this cascade. So here's pregnenolone at the top of the cascade, and it goes down both of these pathways to make progesterone and to make DHEA, androstenedione, and so forth. Notice that androstenedione converts to estrone through the enzyme aromatase, and testosterone uses the enzyme aromatase to make estradiol. All right, so that's a very important thing that I'd like you to take a look at. Now, let's look at her symptoms. Symptom wise, she doesn't have any in the red. She's got a variety of moderate symptoms in the yellow, and this is the lineup. Estrogen dominance, and indeed that's what her labs show, and estrone is too high. The progesterone to estradiol ratio is normal, but her estrone level is high, and so we do have an estrogen dominance. The second is a low cortisol, right here at 21.8. This is 23.1, a low cortisol. 3 and 4 is low. Down here, low and high androgens. And then, so she goes up back and forth, low and high androgens. They're basically the same. And then finally, low metabolism is the fourth one. Okay, so let's go to the next slide. So estrogen dominance is the highest category of bothersome symptoms for DL. And indeed, estrone is too high. 13.7. We don't want that. And so the amount of BiEst that she is using may be too much for her age. She does not define how much she uses, 2 pumps, 1 pump twice a day, 2 pumps twice a day. I don't know. But when your cycles are regular, you generally do not need as much estrogen as you do progesterone. If your cycles are irregular, that's a little bit different. That means you're getting really closer to menopause. If your cycles are still regular, it's likely that you need more progesterone than estrogen. And that is why when you test your hormones before you even start on any young hormone product, you use the chart, and you use the chart I provide on how to choose and use the right young hormones product for you, and you will see that it's very common to need a combination of hormone heaven and hormone protect, because the ratio is generally that you need more progesterone than you need estrogen. And I suspect this is what is happening with DL as well. Now, what do we need to do for DL right now? Well, we need to decrease her estrogen intake, and we need to also increase her estrone clearance and keep these androgens stable. We don't really want them to drop too low or she won't feel good. Okay, so how do we do that? Well, we need to decrease that estrogen intake. So we have a couple of options, or do both. So we need to either stop pregnenolone or decrease pregnenolone. So remember where pregnenolone is on the hormone cascade, and she's currently taking 25 milligrams. I start elderly people at 10 milligrams. So we want to at least decrease it to 10 milligrams, if not stop it altogether. I generally don't really like these hormones on young individuals. And orthomolecular, fortunately, makes a 10 milligram dose. Now, the second thing here's what it looks like right here. Okay, the second thing we need to do is absolutely, without a shadow of a doubt, we need to get on Estrogen, which is diindole methane and indole 3 carbinol, which are natural aromatase inhibitors high in cruciferous vegetables. So let's take a look at the chart here. I've changed it up just a little bit. I've blocked the pregnenolone. We want to decrease this pregnenolone. And when we do, we decrease this downline stuff, but the androstenedione and the testosterone converting to the estrogens by this aromatase inhibitor, which will also help balance these estrogens out a bit. Now, uh, remember, this is likely going to be long term. This isn't, a short term, like, oh, we're going to take it for a month or two. This is while there's hormone replacement on board. All right, especially, I have a feeling, I mean, she's a young lady already on Pregnanelone, so I suspect she's a rather savvy young woman, savvy in her knowledge, and has been doing a lot of reading because most people don't even know about Pregnanelone. So that's how I can kind of tell. Now, so we want to also increase the clearance of estrogen. We want to make sure that we're not missing something. And maybe, I mean, she's a tiny little girl. Maybe she eats tons of cruciferous vegetables. And maybe she needs a little extra help, but she actually that's not the biggest problem. Maybe there's a bigger problem in the gut, that there are some leaky gap junctions between the cells in the gut. And what I'm going to recommend there is Gluta Shield, 1 scoop daily. It's absolutely delicious. I use this almost every day, and I do not have a leaky gut. This is for health protection. And remember, so much of our immune system in here. And also, I like my hormones, and I want to make sure I'm always clearing it well. Well, with leaky gut with these gap junctions, if they separate, then you are not eliminating your estrogens nearly as well. So we want to do, it's got 5 grams of glutamine per scoop, 1 scoop daily. So that's what it looks like. Okay, so let's pop on over to some, talk about a little bit more of the hormones now. However much BiEst progesterone combination you are currently using, I want you to back off to 1 less pump per day. Meaning, if you use 2 pumps twice daily, we're going to decrease this to 1 pump in the morning and 2 pumps at night. I prefer the 2 pumps at night because it's so much better for sleep. And if you use 1 pump twice daily, we want to decrease to only 1 pump at night. So you're going to decrease it by a total of 1 pump per day. Now, here's the thing, you may actually need more progesterone. As a younger woman, premenopausal, still having regular cycles, you may actually need this little bit less hormone heaven, but a little more hormone protect. So if this is the case, we will know certainly within 6 months of doing all this, retesting in 6 months. Make sure you retest your estrone when you retest, and we will know if that progesterone to estrogen ratio is just right. So, if you also tend to get more estrogen dominant symptoms, like for instance, breast tenderness or um, uh, sleep difficulties, and let's see, I thought I saw breast tenderness in here. I'm sorry. I have to ask you to hold on for just a minute. I thought I saw some breast tenderness in here. Yes, I did, right here. Okay. So if you get more of that, that's concerning to me. So I want to know that or headaches, like right now you don't have headaches, or feeling sad, you don't really have this issue, but you do have breast tenderness. If your moods start changing, these could be estrogen dominance, worsening estrogen dominance. If that's the case, you don't need to wait 6 months. You need to get right on additional hormone protect. Okay, what about the hair loss, brittle nails, and cold body temperature. It's not bold body temperature, but cold body temperature. Okay, so let's look at that. You had as your fourth major complaint low metabolism. And these are all symptoms of low metabolism. So, what I'm going to recommend is that you have some thyroid labs done by your local doctor. You can also do a blood spot through ZRT. You're going to want to get TSH, free T4, free T3. TPO, and if you can, if it's available, a reverse T3. After you get those labs, compare them to optimal thyroid ranges, which are defined for you here. And if they don't fit in the optimal thyroid range, you want to add thyroxane, 2 caps in the morning for 2 to 4 weeks, and then 2 caps twice daily after that. And this should help your thyroid function. Now, I'm talking about if your thyroid levels are normal within the normal reference range, but not in the optimal reference range. If they're not in the normal reference range, then your doctor needs to know about it, and you may actually need a thyroid medication. But if they're in the normal reference range, but not in the optimal reference range, this is an excellent product that can help you as well. Okay, DL, I hope that this was helpful for you. I appreciate you very much and thank you for waiting for your video. I'm sorry about the delay. It was my pleasure to do it for you. Give me a thumbs up and I will see you on Facebook. Take care. Bye bye.